Dr. Sarah Khanakwa. I work with the Uganda AIDS Commission, but I'm doing this as a charity campaign for people of my district, Namisindwa district, where I was born. I do this as part of my voluntary, personal, corporate social responsibility for a reason that people we work with or people we live here with in the community require a lot of services. And one of the major services that I see is that health care is very wanting. I can say that it's really wanting in this community, and we can sense from what we are seeing today, we can really demonstrate, observe from what we are seeing today, that we announced for a health camp or a medical camp where we got friends, again through charity, their charity or wishes and all that, to come and provide services at no cost to the people of Namisindwa. We started with this area, Bukhaweka Town Council, and we are targeting people around Bukhaweka Town Council, Bukhaweka Sub-County, Namabia Sub-County, Bukhawusi, Buwawala. So all these people are here, and the numbers are too many. We have just finished, we are still registering. People are still coming, and in the register we are already seeing over 500 people, and that shows us that the problem is real, it's big. And why we did this is we move in the community. These are communities we move in, and we see people are really sick, but they have no idea where to go to. One is the health facilities that we have are not close to where they stay, and then the services there, you find that there are fewer health workers, but also fewer medical, logistics or commodities. So we try to work with the government. We can't expect the government to provide all that the population needs out here, although that is really its responsibility. We work as a private individuals and private sector to bring these services close to the people in collaboration with the government, because we are contributing to what the government could be, is supposed to do. We are adding on what they are doing. So we are seeing that the need is big, and out there we request the government itself to really rethink the health system, because it's really wanting. And for Namisindwa specifically, I would say that there is need to have a health center in Namisindwa, because the services we brought here at the outreach, basically some of them are targeting health center for, and that's why you see the lines are too long. Like dental care, to have a dental surgeon or a dental officer, you have to have a health center for. To have a person for eye care, an optician, that is at health center for. So those are services which are really for a higher level of service delivery point. So we don't have a health center for. The health center for we have here is a private, not for profit. So it's a private entity requiring payment, even if it's a minimized payment. But we are working in a community that is already impoverished. They are poor, and so we require that as a government we see to it as a matter of urgency to have a health center in Namisindwa, and such that services like this are brought to the people. We are going to be here for 2 days. Why is we would have been here for 1 day, but the number is too big, so we may not be able to finish all of them. But also we are having so many people who are critically sick, and those we are making quick analysis and making referrals to the to the hospitals, but also to health center and probably to Mbale Hospital and all that, based on what we are seeing. And then we are also seeing that there are some people who actually have never tested for some of these problems. They didn't know that the routine testing is important. So like HIV testing, the line is too long. Diabetes, high blood pressure testing and all that, the number of screening which are routine. People didn't have that information. So in our health talks, we are trying to encourage people to have these routine services such that they know that it's in order to test or to examine routinely at least once in a year for a person to do an examination. But this of course requires resources. So for us as a team and voluntary or charitable individuals, I'm going to mobilize colleagues wherever they are the medical teams that we are having here. We are having medical teams from TASO, from AIDS Information Center, and from different facilities at within the Namisindwa district. We are going to work up a schedule where we think this mobilization should be done at every year. Once a year, we should provide general routine checkups for Namisindwa people, so that we are able to identify those who require treatment early, so that we don't wait for people to get so sick and then we are not able to manage their condition. So this is going to continue every year.